Assalamualaikum and a very good day to Madam Hanita. We are from Group 2. We are going to present about thalassemia based on our survey by using Google Form method. But before that, let me introduce my team members in this group. So this is our team members. There are 4 members in this group. The first one is our leader, Stephanie Valerie Anak Rorton. Second one is Sarah Anak Pangkas. Third, Nur Farahiyah binti Salem. And lastly is myself, Nurwafi Shukrina binti Mazlan. Okay, so now I'm going to talk about the introduction of thalassemia. Thalassemia is an inherited blood disorder that affects the production of hemoglobin, a protein in red blood cells that carries oxygen and nutrient to cells in the body. It is characterized by the formation of an abnormal form of hemoglobin, which causes several symptoms. Symptoms of thalassemia depend on the type of condition and are generally noted during childhood. Some of the commonly noted symptoms include bone deformities, particularly noted in the face, dark color urine, delay in growth and development, excessive tiredness, shortness of breath, yellow or pale color skin, and abdominal swelling and discomfort. If untreated for a prolonged period, thalassemia may lead to anemia due to reduced normal hemoglobin and red blood cells, enlarged spleen, heart failure, frequent infections, bone deformities, difficulty conceiving, risk during pregnancy, which is heart problems, frequent infections, gestational diabetes, low bone density, and iron overload. This is generally due to frequent blood transfusion. Actually, there is no way to prevent thalassemia since it is inherited. However, certain lifestyle changes could help manage the condition and prevent complications. These include eating a healthy, well-balanced diet, limiting intake of iron-rich food, and maintaining a regular exercise regimen, as suggested by the doctor. Diagnosis for thalassemia involves a thorough physical examination, a detailed medical history, and the required tests such as complete blood count (CBC) and prenatal tests. For the treatment is based on the severity of thalassemia include blood transfusion, bone marrow transplant, medication, and surgery. Medications such as deferoxyros, which is iron chelators, are used to remove excess iron from the body as a result of multiple blood transfusions that are required to correct anemia. Blood transfusion involves replacing the patient's blood with blood from a donor. Bone marrow transplantation, also known as stem cell transplant, involves introducing healthy bone marrow stem cells from a donor. Cholecystectomy, a surgery to remove the gallbladder, is performed for symptomatic patients since thalassemic patients are more prone to developing gallstones. There are 2 problem statements that is needed in this survey. The first one is what is the extent of understanding about thalassemia among the respondents? The second one is how might insufficient knowledge contribute to gaps in awareness regarding the causes, symptoms, prevention, and treatment of thalassemia within this community. There are 3 objectives needed to conduct this survey. The first one is to assess the level of understanding regarding thalassemia among the respondents, such as UITM students, family members, and friends. The second one is to acknowledge the respondent opinion about thalassemia in terms of symptoms, causes, prevention, and treatment needed. Last one is to examine the awareness and perception of thalassemia within the respondent with a focus on identifying prevalent misconceptions and gaps in the knowledge about the condition.
Hi, my name is Sarah, and I will explain the methodology that we use for this case study. First of all, we use Google Form questionnaire. We ask basic questions such as name, age, occupation, and gender. Next, we move on with the questions about the background of thalassemia, in which we ask the respondents about when they first heard of thalassemia and how familiar they are with thalassemia. For the next session, we also ask about the symptoms and causes of thalassemia from the respondents. Besides that, we ask about the prevention and treatment of thalassemia from the respondents and how familiar they are with the treatment that are available for thalassemia. Lastly, we ask about suggestion from the respondents regarding thalassemia. The second method we used was interview. We interview the respondents that are identified as thalassemia sufferer and carrier in the Google form. We ask follow-up questions from the Google form and obtain evidence of the diagnosis given by the medical practitioner. We also ask the person whether they use medication to reduce the effect of thalassemia. So this is the example of questions under each sections in the Google form questionnaire. And this is the example of question asked in the interview where the questions are specified into two, in which one is for thalassemia sufferer and another one is for thalassemia carrier.
Moving on to the next part, which is results. So based on the Google Form survey distributed, 70% among the respondents are non-UiTM students, while 30% are among UiTM students. For the gender, 68.6% are female, while 31.4% are male. For the age group, 42.9% are aged between 18 to 21 years old, followed by 10% are aged between 50 years old, followed by 7.1% are aged between 22 to 25 years old, and the other remaining are from other age groups. For the job, 50% among the respondents are full-time students, while 42.9% are working, and the remaining 7.1% are from other jobs. Moving on to the next part, which is background. So for the first question, where did you first hear about thalassemia? 54.3% among the respondents heard it from school, 22.9% from healthcare provider, 14.3% from media, 7.1% from family members or friends, and the others are from scientific journal. So the next question, how familiar are you with thalassemia? 61.4% among the respondents somewhat familiar, 27.1% among the respondents very familiar with thalassemia, while 11.4% not familiar at all with thalassemia. And the last question, have you or anyone in your family been diagnosed with thalassemia? 92.9% never been diagnosed with thalassemia, while 7.1% ever been diagnosed with thalassemia. Next, we're moving on to symptoms and causes. Based on the Google Form survey, most of the respondents aware that the symptoms associated with thalassemia are jaundice and pale skin, rapid heartbeat, poor feeding, headache, and cold hands and feet. The next question, have you ever experienced or noticed any of these symptoms in yourself or others? 90% of the respondents answered no, while 10% answered yes. The last question, how well do you understand the causes of thalassemia? 54.3% of the respondents answered somewhat well, 27.1% answered very well, while 18.6% answered not well at all. So for the next part, which is prevention and treatment. For the first question, are you aware of any preventive measures of thalassemia? 40% among the respondents are aware of any preventive measures of thalassemia, while 34.3% answered maybe and 25.7% answered no. The next question, are you aware of any natural or alternative treatments of thalassemia? 80% among the respondents answered no, 12.9% answered maybe, and 7.1% answered yes. They are aware of any natural or alternative treatments for thalassemia. The last question, are you familiar with the available treatments for thalassemia? 45.7% among the respondents answered no, 34.3% answered yes, and 20% among the respondents answered maybe.
Hi, my name is Stephanie, and for this presentation, I will present about the discussion part. So, for the first one, why thalassemia might not well known among the communities. So, There could be several reasons why thalassemia might be well known in certain communities. So, for the first one is because of the genetic distribution. Thalassemia is a genetic disorder, and its prevalence is influenced by the distribution of specific genetic traits within a population. If the genetic predisposition is not widespread in a particular community, people may be less aware of thalassemia. So for the next one is the limited awareness and education. Lack of awareness and education about thalassemia can contribute to its low recognition. In some communities, there may be some insufficient information about the condition, its causes, and its impacts on individual and families. So for the last one is limited resources for healthcare. In regions with limited access to healthcare resources, thalassemia might not be adequately diagnosed and managed. Lack of medical infrastructure can contribute to low awareness and understanding of the conditions. So for the next one is what is the symptoms of thalassemia? So thalassemia is a genetic blood disorder that affects the production of hemoglobin, leading to anemia. Common symptoms of thalassemia include fatigue, weakness, pale or jaundiced skin, and an enlarged spleen. The severity of symptoms can vary. An individual of thalassemia may be classified into two main types, which is thalassemia major or thalassemia minor. So these are all of the examples that thalassemia patient would feel, which is jaundice, yellowing of the skin and eyes, cold hands and feet, headache, and pale skin. So for the next one is what is the causes and how does it affects? Thalassemia is caused by mutation in genes responsible for producing hemoglobin, the protein that carries oxygen in red blood cells. This genetic mutation disrupts the normal production of alpha or beta globin chains, leading to an imbalance in the production of hemoglobin subunits. In individuals with thalassemia, the reduced or absent production of one type of globin chain, alpha or beta, results in the accumulation of the other type, leading to the formation of abnormal hemoglobin molecules. This abnormal hemoglobin cannot function effectively in carrying oxygen, resulting in anemia and other associated symptoms. So for the last one, how can we prevent thalassemia among the communities? So there's three ways we can prevent thalassemia among the communities. First one is genetic counseling. Individual with family history of thalassemia or those belonging to population with a higher prevalence of thalassemia should consider genetic counseling. Genetic counselors can provide information about risks of thalassemia, explain carrier status, and discuss the implications for future pregnancies. The next one is preconception screening. Thalassemia carriers, individuals with one mutated genes, are generally healthy and asymptomatic. Preconception screening helps identify carriers before they have children. Screening involves a blood test to check for abnormal hemoglobin genes. If both partners are carriers, there is a risk of having a children with thalassemia. So for the last one is in vitro fertilization (IVF) with pre-implementation genetic diagnosis (PGD). Couple at high risk of having a child with thalassemia may consider IVF with PGD. This involves fertilizing eggs outside the body, screening embryos for thalassemia mutations, and implanting only uninfected embryos. It's important to note that once a child is born with thalassemia, prevention is not possible. However, early diagnosis with and proper management, including regular blood transfusions and iron chelations therapy, can significantly improve the quality of life for individuals with thalassemia.
As a conclusion, this case study on thalassemia explores its genetic complexities, various types of thalassemia, some less severe and others more serious, and challenges for affected individuals. Emphasizing the need for a multidisciplinary approach, it underscores ongoing struggles in ensuring widespread access to accurate diagnosis and comprehensive care. Despite advancements, accessibility remains a significant hurdle. Finding thalassemia early and giving personalized care is crucial and very important. The study highlights the importance of continued research and collaboration to improve treatments and works towards eradicating the disorder. Overall, it calls for a holistic approach considering medical, social, and psychological dimensions and stresses the need for sustained efforts in research, education, and healthcare infrastructure development. Ongoing research is like a key to better tests and treatments, bringing hope for a better life for people dealing with thalassemia. Hashtag Thalassemia Day. Hashtag Thalassemia Awareness.